Do you know why your yearly well-woman visits are important and what to do there? Check out the Reproductive Health Alphabet to test your knowledge. A is for ask. Your healthcare team is there to help you, but they're most effective when you're on the same page. If you don't understand a diagnosis or a word your provider uses, or you're not sure what next steps to take, ask. B is for barrier methods. When most people think birth control, they think condoms. Condoms are a barrier method that helps prevent sperm from entering the uterus. Condoms are not the only barrier method. Cervical caps, female condoms, diaphragms, and sponges are also barrier methods. You can use these with a spermicide to make sure any sperm in the vagina is killed. Unlike most birth control options, you don't have to use these methods when you're not having sex. However, if you want to be protected against sexually transmitted infections, not all barrier methods will work. Only male or female condoms protect against all contact and only when used correctly. If you choose a barrier method for your birth control, be sure to have your doctor demonstrate how to use it to avoid accidental pregnancy. C is for chlamydia. Chlamydia is a bacterial infection that often goes unnoticed because it may not cause symptoms in every infected individual. If symptoms appear, they may include pain while peeing, itching or burning, pain during sex, or discharge that smells bad. If you're having sex without constant or correct use of a condom and your partner hasn't been screened for chlamydia, get tested. Chlamydia is treatable with antibiotics for both you and any infected partners. Without treatment, chlamydia can cause pelvic inflammatory disease, which we'll talk about later, make an ectopic pregnancy more likely to happen, that is, a pregnancy that's not viable and doesn't occur in the uterus where it's supposed to, cause infertility, or be passed to a child during birth, causing eye infections, blindness, or pneumonia. D is for dysmenorrhea. Dysmenorrhea is just the medical term for menstrual cramps. They're painful sensations in your lower abdomen before or during your period. Having cramps is normal, but if they prevent you from completing daily activities like preparing meals or going to work or school, ask your doctor to see if there may be an underlying condition or a way to help. E is for endometriosis. When you have a period, what comes out is the endometrium, the lining of your uterus that makes it possible to cushion the growth of a zygote into a fetus. Sometimes this lining starts growing outside of the uterus, causing pain during periods. Sex, using the bathroom, infertility, bleeding between periods, or extremely heavy periods. You may actually be more likely to have endometriosis if you've never had a baby, have a close female relative who suffers from endometriosis, or have a history of infections in your pelvic area. Endometriosis can be treated with hormones, pain medication, and surgery. If you're experiencing severe pain around the time of your period, ask your doctor if you might have endometriosis. F is for fibroids. Fibroids are another uterine problem indicated by pelvic pain, especially during sex, spotting between periods, and heavy menstrual bleeding. Fibroids aren't cancerous, but they are firm tissues that form inside the uterus and can grow, shrink, or even disappear. Untreated, they can cause infertility or miscarriage, even though most are not dangerous. If you're experiencing pain or irregular periods, ask your doctor about fibroids. Medications and surgical interventions can help. Black women are at a higher risk of fibroids for reasons we still don't understand. G is for gonorrhea. Gonorrhea is another sexually transmitted infection that isn't always obvious. If you are sexually active without using a condom correctly every time, you and your partner or partners should be tested for gonorrhea. If symptoms do occur, they can include greenish-yellow or white vaginal discharge, pelvic pain or pain while urinating, bleeding between periods, swollen glands in the throat, or burning throat. Gonorrhea is treatable with an antibiotic, and you should avoid sex until you and all partners have completed taking an entire course of antibiotics. H is for hormonal contraceptives. Hormonal contraceptives disrupt the bodily processes that release an egg, prepare the uterus for pregnancy, or allow the fertilized egg to implant and grow. While hormonal contraceptives often seem to mean just the pill you take daily, there are many more options. If taking a pill at the same time each day would be difficult or annoying for you, you can get an IUD, which we'll discuss later, a shot every 3 months called Depo-Provera, a patch, or an implant in the arm. It may take trying a couple of different contraceptives to find the one that works for your lifestyle and your body. Be open with your doctor if your periods are irregular, or get worse, or you notice other side effects. It's important to tell your doctor if you smoke, since that can cause serious side effects with some hormonal contraceptive options. I is for insurance. Know your insurance, if you have it and what it covers. The Affordable Care Act, often known as Obamacare, requires that insurance companies cover a yearly well woman visit for a checkup that includes sexually transmitted disease screening, counseling on all the contraceptive options, and providing contraception. However, irregularities have been noted in which contraceptive options insurance companies will provide. Call your insurance company before your appointment to clarify which options are eligible if finances are a concern. If you do not have insurance, you can still get contraception. Try looking up your local Planned Parenthood or other clinics that operate on a sliding fee scale, so you only pay what you can afford. J is for judicial restrictions. Women's health is an issue that has been unfortunately politicized. When making a decision such as the termination of a pregnancy, commonly called abortion, depending on where you live, your healthcare provider may be required to show you an ultrasound, read you a script, or have you watch a video. You may have to wait 24 hours or more between making your appointment and obtaining your services. Know that these restrictions do not reflect your doctor's opinion of you or your choice. Look up the restrictions of your state online before making your appointment so you know what to be prepared for. These restrictions are often designed to make abortion too costly or too inconvenient to complete, but help exists if you need it. Abortion funds and sliding fee scales can help support the choice you make. K is for Kegels. Kegels are an exercise in which you squeeze the muscles of your pelvic floor with or without the aid of a specialized tool to be held in the vagina. Kegels can help women prepare for childbirth, improve sexual functioning, and decrease the frequency of urinary incontinence. L is for LUG. LUG stands for long-acting reversible contraception. Some of the hormonal birth control options mentioned before, including IUDs, which are T-shaped devices placed near the cervix to prevent entry of sperm into the uterus, the shot, and the arm implant are considered LUGs, as well as the copper IUD, which is not hormonal. LUGs are popular because they can last from 3 months at a time, the shot, to 12 years after placement, the copper IUD, also known as Paragard. They don't require you to know when you'll be having sex. However, they don't protect against sexually transmitted infections. If you don't know your partner's STI status, you should use a condom. M is for medical abortion. Medical abortion is the use of 2 pills, one that breaks down the endometrium, the lining of the uterus, and the other that causes the uterus to evacuate, like a really heavy period. The second pill is taken 24 to 48 hours after the first. Medical abortion is usually less expensive than surgical abortion and can be performed generally up to 9 weeks after the first day of a woman's last period. Some states restrict the time period further. Because of the short time window of availability, you should contact your provider immediately after you discover your pregnancy if you do not wish to continue. Abortion funds and sliding scale fee structures can help you afford an abortion if it would be a hardship to pay in full. After a medication abortion, make an appointment with your healthcare provider to get on an effective form of contraception that will work for you to prevent future unplanned or unwanted pregnancies. N is for neural tube defects. Neural tube defects are a class of birth defects of which the most common are spina bifida, where the fetal spinal column doesn't close properly, and anencephaly, the failure of brain and skull to develop. These defects occur during the first weeks of pregnancy when the woman is usually not aware she is pregnant, but can be largely prevented by folic acid supplementation. Women of reproductive age should take a vitamin daily that includes the recommended amount of folic acid, 400 micrograms, to make sure that unplanned pregnancies do not suffer from deficiency. Folic acid also appears to lower the risk of stroke and depression. O is for ovulation. Ovulation is the release of an egg from the ovary following a hormone signal. After ovulation, the egg travels down the fallopian tube toward the uterus and can be fertilized by sperm. Some hormonal contraceptive methods operate by preventing ovulation from occurring. P is for pelvic inflammatory disease. Pelvic inflammatory disease can be caused by untreated sexually transmitted diseases. 90% of cases are caused by chlamydia and gonorrhea. Pelvic inflammatory disease can be extremely serious and cause irreversible damage to the reproductive organs, as well as ectopic pregnancies. 100,000 cases of female infertility each year are caused by pelvic inflammatory disease in the United States. Fever, chills, nausea, vomiting, pain, and abnormal discharge are all symptoms of pelvic inflammatory disease. If you've experienced any of these symptoms, see your healthcare provider as soon as possible. Treatment can range from antibiotics to surgery to removal of the uterus or ovaries. To avoid pelvic inflammatory disease, use condoms and get tested regularly for sexually transmitted disease. Q is for queer. Queer refers to sexual or gender minorities, that is, anyone who does not identify as cisgender, which is their gender is the same as the sex assigned to them at birth, and heterosexual, which means attracted to the same gender they identify as. Queer individuals may have unique healthcare needs such as hormone therapy, as well as adjustments needed to sexually transmitted infection screening, physical examination, and contraceptive counseling, based on their individual partners and bodies. Excellent recommendations for queer healthcare needs, as well as lists of queer-friendly providers, can be found online. R is for rape. Rape is a commonly used term for sexual assault, often including penetration that was not desired by the victim. You can be raped by someone you love or someone you know, and you can be raped even without saying no out loud. If you wish to report a sexual assault, an examination may be required for any physical evidence. Depending on your contraceptive option, an emergency contraception, such as the morning after pill, which is available at most pharmacies without a prescription, or the insertion of a copper IUD, may be necessary. If you feel comfortable talking about a sexual assault with a trusted healthcare provider, can help you access services you may need, like therapy, or adjust practices like pelvic examinations if they trigger intrusive or painful memories. S is for surgical abortion. Surgical abortion can include aspiration or dilation and evacuation. Aspiration involves suction, whereas dilation and evacuation often includes medical instruments. In both cases, pain medication will be provided. Aspiration is most common up to 16 weeks, and dilation and evacuation is more frequently used to terminate pregnancies with fetal anomalies, danger to the mother's life, or late discoveries of pregnancy. Bleeding and spotting can occur after the abortion. The cost of an abortion can be mitigated by abortion funds or sliding scale fees. T is for trimester. Trimesters are the stages of pregnancy, each lasting roughly 3 months. Trimesters can be used to track the expected growth of a fetus and what systems are developing. Trimesters are used by healthcare providers to issue recommendations about the frequency of prenatal care visits. U is for uterus. Uterus, also known as the womb, is the location where viable pregnancies develop. It is the uterus's lining, the endometrium, that sloughs off during a period. A normal uterus that is not pregnant is roughly the size of a pear. V is for vagina. The vagina is the canal that leads from the visible outer lips of the vulva, called the labia, inside to the cervix, which prevents entry of bacteria and other pathogens into the uterus. Entry to the vagina may or may not be blocked by tissue, called the hymen. The presence or absence of a hymen is not indicative of virginity, but you may want to visit your healthcare provider if attempting to break your own hymen is painful or impossible. The vagina is highly expandable to allow for the exit of a newborn's head and is elastic. So don't believe that a lot of sex will somehow make you looser. That's simply not true. W is for weaning. Weaning is the process of getting an infant accustomed to nourishment other than its mother's milk. The American Association of Pediatrics recommends 6 months of exclusive breastfeeding, without food or other liquids other than water, and continuation of breastfeeding with supplementation up to 1 year or longer. Breastfeeding helps improve bonding, but also improves infant health, such as the immune system. If you're interested in breastfeeding, talk to your healthcare provider about resources like lactation counseling and free breast pumps that you may be eligible for. X is for XX. XX are the sex chromosomes of a genetic female, where XY are those of the male. Each parent passes on one sex chromosome to determine the sex of a child. Different chromosomal combinations, such as XYY, can cause different syndromes or non-viability when a pregnancy doesn't continue because it is not compatible with life. Y is for yeast infections. Yeast infections are very common. 3 out of 4 women will get them in their lifetime. If you feel irritation, itchiness, or swelling of the vagina and vulva, and observe thick, white, odorless discharge, you may have a yeast infection. If this is your first yeast infection, or if your infection does not improve with over-the-counter remedies, visit your doctor. Z is for zygote. A zygote is the unicellular organism found when an egg, an oocyte, is fertilized by a sperm. As the zygote develops, the cells divide and the zygote becomes a blastocyst, then an embryo, then a fetus before birth. And that's the A to Z of reproductive health. I hope you learned something, and I hope you'll put these tips into use when you go see your doctor next. Thank you.